Welcome to Learning and Teaching Systemic Therapy podcast, the official society for the teaching of marriage and family therapy, STMFT in short, podcast. I am your host, Dr. Sofia Georgiadou. I created STMFT and this podcast as an antidote to the isolation I experienced as an early career academic. I also created STMFT and this podcast as a space to allow myself and my colleagues to share resources and bridge the way we do systemic therapy with the way we teach systemic therapy in our classroom. Today's episode is especially exciting to me for several reasons. We will focus on a new book in our field called Queer-contextualized Family Therapy toward radically inclusive theory and practice. And I'm joined by the book's editors, Doctors Erica Hartwell and Lindsay Edwards. I want to say a few things about Dr. Erica Hartwell first. She's an associate professor of marriage and family therapy in the Lewis and Clark Graduate School of Education and Counseling. Her teaching, supervision, and scholarship is focused on creating community, compassion, and justice with a focus on queer and trans mental health and well-being. In 2023, she received Fairfield University's highest faculty honor, the Robert E. Wall Award, in recognition of her forthcoming book, Queer-contextualized Family Therapy toward Radical Theory and Practice. She served as the first chair of AAMFT's Queer and Trans Advocacy Network and led the development of the clinical guidelines for LGBTQIA affirming marriage and family therapy. As an AAMFT board member, she also worked on the gender affirming care position statement. All of these will be hyperlinked in our show notes today. Hi, Erica. Very happy to have you with us today.
Thanks, Sophia.
And I want to share a little bit about Dr. Lindsay Edwards as well. Dr. Edwards is a licensed marriage and family therapist and an AMFT approved supervisor. She dedicated 11 years to academia, serving as a faculty within several accredited couple and family therapy programs. During this time, she conducted research, published articles, and provided didactic instruction and clinical supervision to MFTs in training. Currently, Dr. Edwards serves as a manager for Colorado's Behavioral Health Administration, overseeing the Children and Youth Mental Health Treatment Act and other critical mental health initiatives. Beyond her administrative role, she specializes in LGBTQ plus inclusive family therapy, and she remains deeply committed to the field by providing private practice supervision and supervision mentorship. We're thrilled to have you here today, Lindsay.
Hi, thank you.
In our conversation, we'll explore what it means to queer contextualize today as a beginning framework. I sense that this whole framework and its different iterations in the chapters were more of the ongoing question for the field, an invitation for all of us, clinicians, supervisors, and educators to keep examining the assumptions we make when we use our beloved MFT models. We'll also look at how this framework reshapes case conceptualization and intervention planning across the different foundational MFT models. We'll also look at the book's power and capacity as a teaching tool and how we can use it to help our trainees learn how to critique, reimagine, and update MFT theories. So without further ado, let's dive into our first question. I would love for either one of you or both of you to share a little bit more about this queer contextualizing framework. What are some of the questions you would like MFTs to keep asking as they apply this framework to the MFT model they want to use?
I'm looking at Lindsay because while we could both answer this question, I think Lindsay's enthusiasm and mind for asking these big questions, it's just brilliant. So I'm going to tag you.
Thank you, Erica. So our framework, when we started on this journey, we started with thinking about what each of these theories had been for us in practice. And we realized that we often found ourselves in a place between feeling like we were wanting to work with equity in mind and feeling like we wanted to work with intention, work purposefully. And in our own experiences, there was a gap. And we decided that we needed some sort of framework to help narrow that gap so that folks felt like they could work in integrity with a theory while also working in the direction of equity with all of their clients, not just queer and trans clients, but all of their clients. And so, what we asked folks to do was to think about if these models that had been traditionally or historically created in circumstances that centered heteronormative white cis folks, what would they have looked like if they had actually centered queer and trans folks, families, lives, etc. And so we put forward in our framework some steps for that bigger, broader question of if this model had emerged in a context that had centered queer and trans lives as they are today, what might that model have looked like? But then we also wanted to think bigger than just in a context where queer and trans folks are trying to survive oppression, what would it look like? But we also wanted to ask readers to think about what these models might have said if we lived in an environment that centered queer and trans folks as though they're healthy, normal ways of living that they are. So we were asking folks to think about it from these multiple perspectives so that we can really think outside of what our mononormative, cisnormative frameworks are.
I think that last step is really the key one because I think we have a lot of scholarship and resources in the field that talk about like how queer and trans folks, like what we're doing to survive under oppression, like where resilience comes from, what are the disparities and the ways that shows up right in our bodies and our relationships. We have so much information on what it's like to be queer and trans now. But what we're missing is what if queer and trans was the norm? Right? Because part of what we do with these theories is really evaluate and identify who are they centered around. And so if, like Lindsay said, these theories are centered a lot around cis het white middle class folks in the US, the norms are built around them. So what if we built the norms of the theory around queer and trans folks? Then what could the theory look like? And I think that's the piece that kind of starts to take us towards being radically inclusive because we're just not centering it from only a pathological kind of oppressive standpoint.
I love all of this. And something that was particularly meaningful to me in the first chapter, and this first chapter is written by you both, was the example that you offered around re-envision the family life cycle theory. And so some assumptions that emerged as you centered queer and trans folks, thinking about family as a unique emotional system where members enter and exit through birth, adoption, marriage, death, and choice, which was the kind of missing piece here. And then thinking about the purpose of the family to create belonging, to foster community, and to nurture growth of children and the new incoming members. And then finally, thinking about the family life cycle as any event in which families have to adapt. And families we know are becoming more and more diverse and blended in today's America. I love this type of expansive thinking. And I can see how what we called our sacred models for a very long time can benefit from some recontextualizing to imagine how we could apply them in a more radically inclusive way. I am curious if one of you would like to explain a little bit more about particular choice of words, because language is important. Would you like to share a little bit about what made you choose queer-contextualized family therapy?
Yeah, we certainly can. I just listening to you describe what we've done, I think what I want to point out is we were able to take the family life cycle and queer contextualize it. What we wanted to do was build a framework that could be used with all clinical theory. It's a process that helps folks think differently about any theory that they're using. But I wanted to note that our theories in MFT were we could do this really easily with our theories in MFT because they're so process oriented. And even the family life cycle, really what we've done is take each of these clinical theories and we brought them back to process. And in the family life cycle, I think it's a good example of how we noted, if you're thinking from a process level, of course, it makes sense that any transition would be an opportunity for family adjustment and growth. It makes clinical sense if you're thinking about it from a process framework. When we started this journey, we started with thinking about what would we do if we just overlaid what we know about equity, what we know about power, and just considered each theory in the context of power and oppression. And we found that really it wasn't doing enough. And there's actually a decent amount of scholarship out there that we call it the layer cake version. There's some decent scholarship out there that overlays equity, that consciousness of equity on our theories. It leads people to feel like they have to choose again between equity work or working in integrity with a theory. So we really needed something that would help us. We needed a framework that would help us deconstruct and then rebuild it. That's really what we were planning. Was we wanted to deconstruct the theories and then rebuild them. And we thought maybe we're queering these theories is where we started. And we started with Queering Family Therapy, which is a nice title. It's very easy to say, but we received some really helpful feedback in our editorial process from one of our reviewers that essentially raised, if you're going to use queer theory and apply queer theory to these modern models, you're essentially going to deconstruct them into nothingness. It's not doable. You can't take a post-structuralist idea and apply it to a modern model and retain what makes that modern model modern. So as pragmatists, Erica and I, we talked at great length about what we wanted to do, why we wanted to do it, and how we could do it. That feedback to us really sent us down a different path of thinking. Really, we're looking elsewhere for what other resources are out there to help us in thinking about what we wanted to do. And my mother's an artist, so I have a great affinity for art. And I'm familiar with recontextualization in the art world, the way that you take something and you place it in a different context that helps you see the worldview or helps you see the frame that you're using when you view something. So it creates this new meaning and destabilizes some of those assumptions. And so we together decided that we would borrow from that idea of recontextualizing and apply it to MFT theories.
What I was thinking was about the metaphor that Lindsay mentioned earlier of like the layer cake model or layering an affirmative framework on top of a theory and how it doesn't always line up and it doesn't necessarily create like a comprehensive way of understanding relationships and change. So what we're talking about is actually like breaking it back down into the ingredients and evaluating each ingredient and how is this going to contribute, reimagining the recipe and then baking a different cake. And it's got a lot of the similar elements. It's still going to be cake, but it's one flavor throughout that integrates everything rather than piece by piece.
I love this metaphor so much. So there are several models being reimagined and re-envisioned in this book. Just to name here a few: structural, strategic, Satir's model, EFT, emotional focus therapy, Bowen, contextual family therapy, one of my favorites, Gottman methods, and solution focused and collaborative family therapy. So we got so many of the first and second wave models in our field being queer contextualized here. I would love to, if you could share a little bit more, Erica, on the Bowen family therapy chapter, and then Lindsay, you worked on Satir's model. I would love to know a little bit more about these particular chapters and what happened as you reimagined and queer contextualized these two very loved models in our field.
Yeah. I don't know what the consequences of doing this are. I'm going to be very curious what people think about this version of Bowen. This is like the version of Bowen really that I've always understood and used. I think one of the probably more difficult, but also more fun parts of this book and writing these chapters was talking through with Lindsay and trying to understand like, what is the thing that we're doing with these theories? How am I understanding this theory? How am I using it? And how is that different than this original version? Because I think as I was reading Bowen and trying to understand Bowen 15 years ago, I would come across these pieces and I'm like, no, that doesn't quite fit. Or the way this person's interpreting it, I don't think that's what this means. And I would just rework it as I went. And it continued to make sense to me, even as I was going. So I think I was revisioning it the whole time. And then it was, I think 10 years ago now that Lindsay and I were in a conference session together. And I presented like a case example where I was working with the parents of a transmasculine child. And I was talking about how I was doing that work through Bowen. And it just made perfect sense to me that how Bowen lined up with the work that I was doing with these parents. But for a lot of folks, they were like, wait, Bowen can be trans affirming, Bowen can be queer affirming, Bowen's feminist. And Lindsay, to her credit, was like, Erica, this is a book. We should write this book. And it took us a little while to get there, but Lindsay was like, this is a book and an exciting book to write. So we had to dig through, what did Bowen say and how is everybody else reading Bowen? And then what are the pieces that I've reimagined over time, and then really breaking it down back to Bowen's assumptions. An example, I think, of something that people often just have some issue or concern with over Bowen. There's a lot of things actually, and I talk about a lot of them in the chapter. But one piece that I'm often confronted with, because I teach Bowen quite a bit, is this idea of emotional cutoff. And I have some students who have a lot of feelings about the idea of emotional cutoff because they may be cut off from folks in their life. And they're like, does that mean I'm not healthy in this theory? Can I never be considered differentiated or mature because I'm cut off from people? And then when we put queer and trans folks in the center, particularly in our current oppressive context, we see a lot of folks cutting off from their family, sometimes by choice, sometimes not by choice, because of rejection or abuse or violence. So there's homophobia, there's transphobia in their families. And so they have cut off contact for very valid reasons. And surely Bowen wouldn't, maybe he would, right? But in my head, I'm like, surely we wouldn't look at that through this theory and say that's unhealthy. So what distinguishes the difference between an emotional cutoff and a healthy cutoff? And so one of the ways that I think about it is we can cut off from somebody physically. We can stop communicating with them. And that can be a conscious, emotionally mature choice, or it can be emotionally reactive, where we're cutting off and from this very emotionally reactive place where there's intensity around it. There's unresolved conflict. There's unresolved feeling. And that's where that reactivity comes from. But if we can resolve the emotions attached to that and turn that into a conscious cutoff, then I think that's distinct from an emotionally reactive cutoff within the theory. So it's not that we can't choose to stop communicating with people. It's about how are we doing it and how are we processing it? Is this still bringing up anxiety and reactivity for me and my body? Or is this something that I've resolved and I'm making this as a conscious choice?
I love all of this. I was looking at this chapter, and as an educator and having heard a lot of students' comments about different texts over the years, I love that this book is very succinct in its content. And also, it's not a rundown of text on text. And it seems to me that each chapter contains a table where you break down or you summarize the original assumptions of the model and then the queer contextualized assumptions. And that really brings it home for me. You basically crystallize everything that's in the chapter in that table, and then students or readers can go in and dig around more and read more. And you also have case examples and therapist client dialogue of how these assumptions perhaps are addressed in therapy, right?
Yes. I think a lot of our experience as educators went into how we wanted to put this book together, and thinking about what helps students in particular take in, especially theoretical information, which can feel so dense and so abstract. And it's really hard, especially at the beginning of your training as a therapist, to imagine how this theory looks in the room. And so we wanted to put in, right, the assumptions comparison just to really distill like, this is the meat of what we're trying to tell you here. And in the case examples, to also give a really clear example of this is what it might look like. And here's why it might look like that based on how the theory's been queer contextualized, to hopefully help folks who are trying to imagine what this theory looks like in the room and what's different about it, to give them a more concrete visual.
Yeah, I love the examples of dialogue.
Yeah, I just wanted to give recognition where recognition is due. The voice of this book is largely due to Erica's original conceptualization. She wanted to write this book in a way that was accessible to readers of all backgrounds or levels of experience, but also I think to write in such a way that we are outside of the performance of academia. And that was very difficult being in academia. We had to commonly give feedback to each other, give feedback to our authors that we wanted this book to be different and to read differently. We wanted people to say the things that go unsaid, that are not typically said. And we encouraged folks to write in a way that wasn't as confined by our academic notions of what is a well-written document.
What is good academic writing? Yeah.
Yes, exactly.
Right.
Exactly.
Mhm.
What is good academic writing? And so we did really push folks to just say it. I think there was a couple of times where Erica and I, in our feedback to authors, said, just say it. Say what you think is most important here and put it on paper. And Erica and I tried to do that ourselves. And I probably struggled with it to a greater extent than Erica did. She helped me with just saying it. And so wanted to write this acknowledging that there's a lot of resources available for folks to understand what these theories are in their original form. And we wanted to prioritize in our pages the new version. And so that's really why each chapter is structured the way it is.
Yeah. And I also love the reflection questions. And I think these are in just about every chapter, right?
That's right.
Yeah, that help students and the trainers and supervisors and educators, whoever is using this book, to go a little bit deeper into the content and kind of process. What does this all mean? What do I do now with this information? Lindsay, did you want to share a little bit about recontextualizing or queer contextualizing Satir's model?
Yeah, I'm happy to. I actually commonly refer to my chapter as my love letter to Satir because it felt like that. I fell in love with this theory even more as I was going through this process of queer contextualizing it, in part because I realized Satir was pretty much already there at the end of her career, but I'm just speculating here. I'm assuming her context didn't allow her to use the language that we can now use. So she used their language. But if you consider the theory itself, if you're operating at the level of process, the queer contextualized version of Satir just seems reasonable. It seems like that's the way it should always have been, in my view, because her ideas about congruence and the way that congruence props up a threat reward system can be so easily extrapolated to broader systems of oppression, and how incongruence among family members, within folks, is necessary for power structures to sustain. And she did get there at the end of her career when she started writing about the ways that incongruence might have contributed to a variety of different traumatic circumstances, wars, etc. She did get there. And really, the chapter that I wrote was recognizing the potential of what Satir created, which is to think about how our own incongruence isn't just a dynamic of families, it's a dynamic of culture. And our work in the interest of liberty requires congruence. And some of that congruence is emotional, but also somatic. And there are other current authors that have written about liberty in the body and somatic change. And I think now is a perfect time to start thinking about satire and her ideas as justice work. In what she wrote, what I saw was that congruence is the antidote to oppression. As a white woman, if I'm congruent, I cannot tolerate the impact that I'm having on other people if I'm being racist. So I will be congruent and connected to the emotional experiences of the folks across from me. And in that, I will make different decisions because I'm congruent. So it won't sustain if, as someone who is enacting oppression, I'm congruent. And in the same way, someone who is experiencing oppression, as a white woman, I've experienced oppression related to my gender. If I'm congruent, I can feel the pain that's being inflicted upon me and I can't tolerate it. So I'll do something different. And that idea is in satire, but not fully elaborated upon. I think she would have gotten there if she'd lived longer.
Wow. I'm digesting everything you just said, Lindsay. Looking at the original assumptions and queer contextualized assumptions for this chapter, the first wave models didn't exactly include the social political context or collective grief into case conceptualization or the idea of what is healthy family, what is a normal family functioning, etc. All the societal pressures were not really taken into account into these original models. And I love that they're being brought in and reimagined here. One thing that was important for you was this key thread that this textbook is not only about queerness or queer folks or trans folks, but it's about re-envisioning how these foundational models could be applied for the benefit and service of any marginalized identity or positioning. I'm wondering if you have any thoughts you would like to share about this as you're looking at this body of work now coming into life and becoming a publication officially.
My first thought is in the chapter that I wrote, in the case study, what I attempted to highlight was the way that the trans family member in this family that I wrote about, they were in so many ways more congruent than the family members around them. And what I wanted to highlight was what a gift it was for this family to have a family member who, because of their experiences, was so congruent that it really invited the rest of the family members to be congruent. They were doing the work of their family, inviting them to be more congruent. And what I wanted to show in my case study was the family members accepting that invitation to grow and change alongside their trans family member. So when Eric and when we started thinking about reimagining these models, I don't know, Eric, if you have a different opinion about this, but it felt to me like we intuitively knew that it was going to benefit everyone, that this work of working from a queer contextualized framework works for everyone. It benefits everyone. It actually, I think, centers the growth and the resilience of queer and trans folks and highlights that it's really an invitation for everyone else to grow in the same way.
Yeah. And I think the framework here can be used from any perspective, right? You could take any form of marginalization and move those folks into the center and then say, okay, now how would we reimagine this theory around this particular margin? And so it's a process that we can do with anybody. And we started with queer and trans folks. And in every chapter, I think we're doing our best to look at queer and trans folks across multiple intersections to bring as much into the center as we can. But surely in every chapter, we are missing things. We are missing perspectives. And so my hope would be is that people read these chapters and then continue to recontextualize the theory beyond that and say, okay, but then there's this experience that hasn't been centered. And so how would I adapt it to then bring that experience into the center? And then I think the other reason that we can say this isn't only about queer and trans people is because oppression isn't siloed. We can't separate homophobia is over here and transphobia is over here and racism is over here and misogyny is over here. Like they don't live in silos. They're so intertwined and they operate in such similar ways that I think if we try to disentangle them first, I think it's inauthentic. And then second, I think it's ineffective because our oppression is all tied together, as is our liberation.
As is our liberation. I love that. I'm wondering if the two of you would like to share some of your influences that informed this work. Maybe anyone you would like to acknowledge here. I know you mentioned already intersectionality in Kimberly Crenshaw's intersectionality theory. I'm also thinking a lot about Bell Hooks. As I was reading the book, I was thinking a lot about her teachings and what she stood for. I am wondering who else has, of course, your own lived experience, I'm sure, but was there anybody else who was like a lighthouse and inspiration for you that guided you in this work?
It's a really good question.
Okay.
Yeah. So Kimberly Crenshaw and the Combahee Collective are cited multiple times throughout the book, as is Bell Hooks. But I'm also thinking within our field too. I'm not the first person to critique Bowen or try to reimagine. There's been lots of excellent feminist critiques of Bowen, feminist critiques of family therapy. And I think that we talk about that quite a bit. Rachel Harum-Houston. I think if with Bowen, there's Silverstein, Knudsen Martin, but also something that Lindsay and I talk about, particularly in our acknowledgments, are like our elders in the field. So the MFTs who came before us, long before us, to the point where they may be retired now or even no longer with us, who really took the big risks professionally to talk about queer and trans folks at conferences, to do research, to publish, to mentor students, and face a lot of backlash for it, who are trying to move our field forward, and were villainized for that. So I think probably more than anything throughout writing this book, we were thinking of how to honor those folks and what they were hoping and envisioning for our field.
I think one of the things I was most excited about for this book was that we were able to have a foreword written by Jamie Long. And I was so moved by reading what she wrote. I would encourage anyone who's reading our book not to skip the foreword. It's so important and so meaningful. Our students need to read it and understand the context, the historical context of this book. You've heard us say this is just the beginning. We also need to recognize that it's been a long time coming. I'm getting goosebumps and feeling emotional now, even thinking about it, because the history that Erica's referencing, it's so important that we understand the history of MFT as a field, and we understand that context, how our theories emerged, the folks who first stood up and said, wait a second, this doesn't work for me. This doesn't work for my clients, and wrote it down so that it was there for us to pick up with this work. That's so important.
You're dedicating this book to those who see the potential for a better world, one where all people, all is emphasized, are treated with respect and dignity, and have invested their whole radical selves in pursuit of this endeavor. And so I'm hoping that more of us experience this book as a way of being seen and heard. And that includes not just clients we serve, but also our students, our colleagues, all of us. I'm wondering, as we're closing, if you would like to share anything about your editorial process. This podcast has a large audience of educators from around the world who might be considering editing text with multiple chapter authors. What was that process like for you? And it's always fun to write with a beloved colleague. I am wondering, what were the waves and what was that journey like of editing for you? If you would like to share anything about it.
It takes a lot longer. Took a lot longer than I thought it was going to take. That for sure. There's a lot of lessons learned, I think, in our first go around with the book. Not like just a book, but an edited book. I think our original book contract was for a year. And we mapped out this whole timeline of how we would get this done in a year. And looking at the timeline, it's like, yeah, that's totally doable. And then living it was like, oh no, this is going to take so much longer. So it actually took us about 3 years from the time we had the book contract until the complete manuscript was submitted. And some of that is just the minutia and the nitty gritty of formatting and organizing a book and with multiple contributors to it. I think something that for Lindsay and I were like, oh, I didn't know this is going to take this long, which is really the editing process and the revising process. And I think some of that is because we had just this really clear vision of what we hoped the book would look like and feel like and what we wanted it to do. And it took a lot of conversations and going back and forth with authors to really highlight and bring forward what are your unique ideas that you really want to bring, and then how do we fit that into the shape and the vision of this book. And our authors, I have to give them a lot of credit as well for their patience with us as we were like, okay, we love this, and can you do this? And so there was a lot of back and forth, a lot of conversations with our authors, and a lot of conversations with each other. A lot of honestly really fascinating, sometimes mentally exhausting, just theoretical, philosophical, a lot of theory conversations have happened between the two of us in the last 5 years, I'd say.
Yeah.
Yeah.
What you're saying, Erica, is that really, like, this book in particular, I think, was more of a process than it was a book. We underwent a process. We invited authors to go along with us on that journey through that process. It's not that we had all of this knowledge in our heads at the start and just decided to put it to paper. We grew in our understanding of these models. I grew as a clinician, I grew as a supervisor through our conversations. Mine and Erica's conversations were, yes, we had so many of them and they were so enlightening. And we played with concepts and we invited the authors to do that with us too. We had to keep asking ourselves, is this a part of the model in its original form, or is this because I've already digested this and I'm doing this? And in our original conceptualization of the book, we wanted authors who lived and breathed a particular theory and had worked in the direction of equity so that we could help them decipher that same question. Is this because you do this, or is this because this is what the theory dictated? This is what the original theorist had in mind. Where's the adaptation that you've already done? I think that was probably the hardest part. And it was hard because the folks that we asked to author chapters were so seamless in their application of their model. So it was such a journey. That's why I wouldn't have it be a day shorter than it was, because it was exactly what we needed in order to put together our ideas and to put them to paper and to revise them, reconceptualize what we'd already put to paper. I'm so proud of what we did. And I really think this book reflects the journey that we went on as editors and authors together.
As a reader, I'm very grateful that 3 years of work and probably many years of work before to even conceptualize something went into this book. I am very excited for this to go into our classrooms and start conversations and action and activism and advocacy for our field. I'm seeing that this book is available on Routledge, Amazon, Vital Source, and a couple other bookstores now. So it's out and you can purchase the hard copy or electronic copy. Anything else we want to share about this book as we close out? And also, each of you, if you could share, how can listeners reach out to you if they're interested in what you do?
I was going to say, I can just give you my email address. I'm happy to do that. So if you can reach.
Yeah. And I'll just say that what I want to do is reach out and let folks know, like, I would love to hear what people think about what we've written. I would love to hear from folks. I would love to have conversations with folks about what we've written. I'm just waiting for somebody to say, oh my gosh, this thing that I read was whatever, fill in the blank. Or, gosh, I totally disagree with what you read. That's totally wrong, Lindsay. Like, I want to hear that. I want to have those conversations. So I wanted to end by expressing an invitation to folks who feel moved by what we've written in some form or fashion to reach out. and to have these conversations with us, have these conversations with our authors. I'm volunteering them for work, but have these conversations with them and just talk about this. Talk about it.
I think I'm really interested in the folks who reach out with the yeah buts, like the critique. And I'm imagining getting them from both sides with the this is not what this theory is, and you've lost the essence of something, or I disagree with this theoretical assumption. And then we can go down that intellectual rabbit hole. And then there's gonna be the folks who are gonna be like, okay, but you didn't think about this. What about here? There's a blind spot right in here. And it's yeah, of course there are. There's gonna be blind spots and biases throughout the book. And my hope is that people will tell us what they see and how they're extending or expanding what we've done. And that's why the subtitle of our very long title is Toward Radically Inclusive Theory and Practice, because that isn't a destination. That's not something we can just say, it's done. We've made this theory as inclusive as it could ever be, full stop. Because first of all the authors in this book are all humans with their own limitations within that. And then also, we're always changing as humans. And so our theories should continue to change with us. So this work isn't ever done. And I'd also love to see people expanding this out, of course, beyond queer and trans folks and integrating more pieces that were left out of the original model. Lindsay mentioned somatic work earlier in the Satir chapter. I mentioned somatic work in the Bowen chapter. There's dance movement therapy in the strategic chapter. A few authors have brought in somatic work, which of course was large and totally ignored with some of our founding modern models here. And so just to see other ways that people are saying, this is how I integrate this aspect back into these theories. So I'm just excited to see where people go with it. I want it to be like a living, malleable, moving document.
Sounds like there's a second edition brewing somewhere in the horizon. Just kidding. I don't want to terrify anybody. Yeah, I know. Yeah, I can see the reactions in your face.
Let me recover from this book. No, but to your point, Sophia, yes, immediately there is a second version. As soon as it was submitted, there's going to be new ideas and things that we would need to add to it. So yes, does the second edition exist? Absolutely. Do I need a minute before I do something like that? Yes.
Yes. Recovery first. Let's not pour from an empty cup here. And Lindsay, how can listeners interested in your work reach out to you? Would you prefer your email, or is there another way for them to reach out?
Yeah, thank you. I have a website, drlindsayedwards.com. And folks can find me there.
Wonderful. Okay. We will share those links in the show notes. And I am so thankful for your time today. To our listeners, I hope you found today's discussion enlightening and inspiring. I am just so thankful for Erica and Lindsay for coming on and sharing their wisdom and their very hard work with us. I want to say also to our listeners, if you're hungry for more of this type of conversations about teaching systemic therapy and reimagining our training, follow our podcast on Apple Podcasts, Spotify, wherever you listen to your favorite podcasts. We post every month, so stay tuned. Thank you for joining us today. This is Dr. Sophia Georgiadou.